Hello guys, now we shall be discussing regarding the wrist joint. Okay, so our topic of discussion today will be on the wrist joint. So we shall be discussing all the important things that are needed to understand the wrist joint. Okay, right. So look at this picture, guys. First of all, we shall draw some things. We shall label some things over on this picture, and then we shall discuss the wrist joint. Okay, now first important thing, this is your radius bone, you know that, and this bone is your ulnar bone. Okay, and if you can see here, this thing over here which you can see, it is a little bit sharp, right? So this is called as styloid process of the radius. What is this here, right? What is this here? This is called as a styloid process of the radius. Styloid process of the radius bone. In the same way, for ulna also we have got something here. This is called as the styloid process of the ulna. Styloid process of ulna. Okay, styloid process of ulna. Now between the radius and between the ulna, if we get a joint, if there is some joint between radius and ulna, you call it as a radio-ulnar joint, right? As you can see here very clearly, that we have got a joint between radius and ulna like this, right? Look at this joint here. All of you can see. Look at this joint. There is a joint between radius and ulna. This is called as a radio-ulnar joint. Okay, what is this joint? This joint over here. This joint over here, you call it as a radio-ulnar joint, or you can also call it as articular disc. You can also call it as articular disc. Okay, now down here you have got carpal bones, right? All of you know how to remember, because I have already told you regarding the carpal bones and all the important things we have discussed regarding the carpal bones as well. And I even given mnemonic for you how to remember the carpal bones, and by now you might have already known what are these carpal bones and what are its names. Okay, so I'm just writing down these carpal bones here. S stands for scaphoid, you know it. L stands for lunate, right? T stands for triquetrum. T stands for triquetrum. And there is one more bone over here, the small one, right? This is called P. P stands for pisiform. Okay, so scaphoid, lunate, triquetrum and pisiform. And here we have got trapezium, and we have got, okay, let me put up the trapezium in this way here. Okay, trapezium TR, trapezoid is TZ, right? Trapezoid, capitate, this is the largest carpal bone, and next we have got hamate bone, which has got a hook, right? But anyways, these things we have discussed in the carpals lecture. Okay, so she likes to play, try to catch her. Scaphoid, lunate, trapezoid, scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate as well as hamate. So the upper four, like scaphoid, lunate, triquetrum and pisiform, they are proximal, and the lower four are distal. This thing you know, right? Now what is this red color dotted line over here? If you can see, this red color dotted line is representing wrist joint. Okay, this red color dotted line is representing wrist joint. Okay, before we discuss wrist joint, and one more important thing is that this is the first metacarpal, second metacarpal, third metacarpal, fourth as well as fifth metacarpal. Okay, now what is a wrist joint? Now wrist joint is formed between what and what? If you can see here very clearly, I am drawing a violet color line, and that is what is wrist joint, guys. Look here. The wrist joint forms all the way from the radius like this to the articular disc. Ulna is not included under the wrist joint. Wrist joint is formed between the distal end of radius, articular cartilage and the carpal bones, right? So wrist joint is formed between what and what? Wrist joint is formed between, so this is your wrist joint, this is your ulna, let us say, right? And all of you know that you have got a disc like this. This is called as articular disc. Okay, and all of you know that you have got, let us say, 1, 2, 3, 4 proximal row carpals. Okay, what are these proximal row carpals once again? So scaphoid, we have got lunate, trapezium as well as, triquetrum as well as pisiform bone. So this is the wrist joint. Wrist joint is formed between the distal end of the radius and the articular disc. Distal end of the radius and the articular disc are joining with the carpals on the proximal row. Okay, if I have to put those things into a written format, just look here. It is formed by the distal end of radius as well as the articular disc with what? With proximal row of carpal bones. Proximal row of carpal bones. So this is what is called as your wrist joint, guys. Okay, this is what is called as your wrist joint. And you know, wrist joint is very, very important because many questions have been framed regarding this wrist joint. Okay, so you definitely have to learn about this wrist joint, right? Second important thing is that what are the first MCQ which they're going to ask is that what is wrist joint, how wrist joint is formed, right? And the second important MCQ that they can ask you is that what are the ligaments of the wrist joint. So let us right now look at the ligaments of the wrist joint. Ligaments of the wrist joint. Now coming to the ligaments of the wrist joint, the first important ligament which you can see is called as the capsular ligament. The first important ligament is called as capsular ligament. I cannot show it to you here, but I'll just explain you. Capsular ligament is also called as a joint capsule. So here we have got the radius, we have got the ulna, we have got the carpal bones, right? So there is a ligament that is completely surrounding these area, completely like a band it is surrounding this area. So this is called as capsular, like a capsule it is surrounding it. You call it as capsular ligament, or you can also call it as joint capsule, or you can also call it as joint capsule. You can call it as joint capsule. Second important thing is that there is also a ligament. If you can see here very clearly, there is a ligament that is attached to the radius, the styloid process of the radius, right? I told you this is styloid process of the radius. From the styloid process of the radius, it is getting all the way attached to the trapezium. Okay, so what is that ligament? That ligament is attached all the way from the styloid process of your radius to your trapezium. And this particular ligament, it is towards the radius bone on the radial side. You call it as a radial collateral ligament. Okay, what is the name of the ligament you call it as? You call it as a radial collateral ligament. Third important thing is that you also see one more ligament on the ulnar side. Now from where it is coming out? It is coming out from the, what is this, styloid process of ulna, and from the styloid process of ulna it is attached to triquetrum. It is also attached to the pisiform, isn't it? It is attached to triquetrum and pisiform. So it starts from the styloid process of ulna all the way to triquetrum and pisiform. And what is this ligament? Over here? This is on the ulnar side. You call it as ulnar collateral ligament. What is this? Ulnar. One is called as the radial collateral ligament, another one is called as the ulnar collateral ligament. Now let us look at the remaining ligaments here, right? So the remaining ligaments are, look here, there is one ligament, and by the way, let me name it here. This is scaphoid, this is lunate, this is triquetrum, and this small one is pisiform, right? Now there is a ligament that is attached all the way from the radius till scaphoid and lunate, right? If you can very clearly look at this ligament over here, right? This ligament over here, right? So all the way this ligament is attached from here. It is attached from the radius in the sense the distal end of the radius and all the way down it is attached to scaphoid as well as lunate. It is attached to scaphoid and the lunate bone. And where is it getting attached? It is on the ventral side. It is on the palmar side, right? So this one is your radius bone. From the radius, there is a ligament that is going and attaching like this on the palmar side. So this ligament is named as palmar. Palmar attachment is from radius to carpal bones. So palmar radiocarpal ligament. This is called as palmar radiocarpal ligament. What is this? This is called as palmar radiocarpal ligament. Okay. Exactly look the same ligament on the opposite side as well. You can also see another ligament, and that is attached all the way from the ulna. And down it is attached to triquetrum as well as pisiform, right? All the way it is attached from the ulna to the triquetrum as well as pisiform. This ligament is called as, and by the way, let me write down about this ligament, right? So this ligament all the way attaches from the ulna. Ulna on which side? The distal end of the ulna, right? And down it is attached to triquetrum and pisiform. Triquetrum and pisiform, right? So this is also on the palmar side, so I can call it as palmar, right? And it is attached all the way from the ulna till the carpal bone, so ulnocarpal ligament. Ulnocarpal ligament, right? Ulnocarpal ligament. So two things, palmar radiocarpal ligament and palmar ulnocarpal ligament. Next important ligament is that if you can see this, that the radius is laterally placed, right, and the ulna is medially placed. So this is on the dorsal side. Previously we discussed ventral side, that is why it was palmar. Now it is on the dorsal side. On the dorsal side, what is the ligament? The ligament is all the way attached from the radius, right? It is attached to which bone? Look here. This is your scaphoid, this is your lunate, this is your triquetrum and pisiform. It is all the way attached to scaphoid, lunate and triquetrum, right? So attachment on the dorsal side, right, from the radius. Again, what radius? Distal end of the radius. It is attached all the way down till these carpal bones. What are the carpal bones? Scaphoid, right? It is attached to lunate. Not only that, it is also attached to triquetrum, right? So this picture, whatever you can see here, this is called as dorsal radiocarpal ligament. So how many ligaments do we have in total? So far we have discussed the first important ligament is capsular ligament. Next important ligament is radial collateral ligament. Third important ligament is ulnar collateral ligament. Fourth important ligament is palmar radiocarpal ligament. Fifth important one is palmar ulnocarpal ligament. And finally, we have got the dorsal radiocarpal ligament. Okay. Now another important thing is that if you look at the movements, of your wrist joint, what are the types of movements I can do? Look here, I can do like this. It means I can do flexion. Now what is this action? I can do extension of wrist, right? And I am moving my wrist laterally like this, right? So this is called as adduction, whereas this is called as abduction. So I can also do abduction. I can also do adduction, and I can also do circumduction of wrist. Now, what is flexion, extension, adduction, abduction as well as circumduction? All of you know that this is flexion, this is extension, right? Now, if I am moving it like this, I am moving laterally. not laterally. This is my anatomical position, right? If I'm moving like this, it means I'm moving medially. This is called abduction. If I'm moving it like this is called lateral. This is called adduction. And this movement is called as circumduction, right? Now, what is the range? What is the degree of range of movement? So, flexion can happen all the way. See, this is 0 degree. From 0 degree, I can flex till 60 degrees. 0 degree till 60 degrees. But whereas extension, 0 degree till 50 degrees. And what about abduction? 0 degrees till 15 degrees. Why? Why 0 degrees till 15 degrees? You only see. See here, I am able to flex it. I mean, I am able to adduct my arm like this, right? So in the same way, can I do it on the opposite side? No, I cannot do it on the opposite side. The range of motion is restricted over here. But here the range of motion is not restricted. But here it is restricted. So the angle also will be less, 15. Then what about this angle here? 50, 0 to 50 degrees. And circumduction is completely making circles, right? So this is an important thing which you need to know. Okay. Next important thing which you need to know is that we shall be discussing regarding the first carpometacarpal joint. What is the first carpometacarpal joint? It means I'm discussing about your thumb region. Thumb is your first carpometacarpal joint, right? So which is the thumb region over here? This is the thumb region over here. Now how is this first carpometacarpal joint formed? See, first of all, where is this carpometacarpal joint? This is the carpometacarpal joint, that blue color thing, right? So this carpometacarpal joint is formed between, first look here, this is called as trapezium and this is called as the first metacarpal. So it is formed by, look here, this direction is called as what? Proximal. This direction is called as distal. So it is formed by distal end of trapezium, and between distal end of trapezium and proximal surface. Proximal surface of what? Proximal surface of your first metacarpal. Okay. So it is formed between the distal end of trapezium and the proximal surface of your first metacarpal. So in between both of this, whatever joint has been formed, this is called as carpometacarpal joint, right? So what are the ligaments here? What are the ligaments here? The first important ligament which you can see is your capsular ligament. Obviously there will be capsular ligament everywhere. Second important ligament. What is the second important ligament? Look here very carefully. If you see a ligament all the way like this, right? So this ligament is called as lateral ligament. What is the name of this ligament? This is called as lateral ligament. This is called as lateral ligament, right? Third important thing is that if you look at the ligament in the center like this is called as anterior ligament because it is on the anterior side, right? So this is called as anterior ligament, right? The same place on the back side, right? The same place on the back side. See, here there is a ligament. This is called anterior ligament, right? The same place on the back side here, this will be called as posterior ligament. So the next one will be called as posterior ligament. So how many ligaments do you have? You have got capsular ligament, right? You have got clap ligaments. What are that? You have got clap ligaments. What are the clap? Capsular ligament, L for lateral ligament, A for anterior and P for posterior ligaments. Okay. Now, if you look at the blood supply as well as the nerve supply, all of you know blood supply is radial artery, right? The blood supply will always be radial artery. That what forms one of the content of the anatomical snuff box. And the nerve supply to this joint is your median nerve, and it would be your median nerve. Okay. Now, what are the thumb movements? What are the thumb movements? What are the thumb movements, guys? See, if I am able to flex my thumb, this is called as flexion. If I am able to extend my thumb, this is called as extension. Flexion and extension. Okay. So, what are the thumb movements? The first one is the flexion, like this, and the second one is the extension movement. Extension movement. Okay. Next, I am able to push the thumb towards my body. This is called as adduction. This is called as adduction. I am able to move my finger away from my body. So this is called as abduction. Abduction. And the fifth function is I am able to count my fingers. I am going opposite direction of each finger against each finger like this, right? So this is called as opposition. This is called as opposition. So these are the functions of your thumb. Okay. So thank you so much for watching my video. So this is the end of the video. Thank you.